Hi, I'm Dr. Anthony Crifase, and in this video, we're going to be discussing how to heal your thyroid. In this video, I'm going to be going over the major thyroid markers as well as other markers that are pertinent to the thyroid, the entire thyroid pathway, and where these thyroid disorders can develop within that thyroid pathway, and then how to resolve them. Alright, so the first thing that we want to talk about is the major thyroid markers. And we are going to start with the brain actually. So instead of starting with the markers, we're going to start at the level where the thyroid hormone pathway begins. At the level of the brain, your brain produces TSH. Now, TSH is produced in the pituitary gland. So TSH is not a good marker for overall thyroid production. It's kind of the control cell towers for your thyroid hormone pathway. TSH does is it will come down and it will stimulate the thyroid to produce T3 or T4. A majority of thyroid hormone is T4, yet T3 is the active portion. So you can imagine, well, if T4 is not working, we don't want that. We want it to work. So we need to make sure that there's an abundant amount of T3 present. Now, the thyroid can also produce a couple other hormones, and these are called reverse T3, which is very similar to T3, but it's actually more like T4 because these are both inactive. So if they're inactive, they don't do the body much good. Now, the question is, why do these elevate? And we'll go over those in just a second. We missed one step, and that is TRH that starts at the level of the hypothalamus, but we don't need to go over that necessarily for this pathway, as the majority of thyroid hormone conditions are related to the immune system, also known as hashimoto's, and that is what we're going to be covering primarily today. There's also Graves' disease, which follows a similar pathway as well though. So the thyroid produces T3 and T4. Now here's the thing, these T3 and T4 need to make its way into the cells. If they don't make their way into the cells, then you're not going to use thyroid hormone ever. And that's pointless. You need to use thyroid hormone. So we want to make this into the cell. In order to get T3 into the cell, and this is peripheral cells, we need to have a number of nutrients. These include vitamin A, vitamin D, zinc, magnesium, and other B vitamins. So this is the thyroid hormone pathway in a nutshell. Now you might be wondering, well, this seems pretty straightforward. It can be pretty straightforward if the body is working properly. If the body's not working properly, then you're gonna have a lot of dysfunction with it. Now, this is simplified format, but the most important point here is how do we get that conversion to occur? Now, T4 actually turns into T3, and this uses a number of nutrients, one of which is selenium. Now, this is important, but this is an often overlooked piece or overestimated, as most people think, well, you just need more conversion, just give more selenium, just give more zinc, just give more iodine. Those are a couple other things that are going to help with this conversion, but there's much more to the big picture. You convert T4 to T3 not just in the periphery using these different nutrients, you also convert it primarily in the gut and in the liver. So 20% of this conversion right here occurs in the gut and in the liver, along with other organs. So if the gut is not working, which in many thyroid cases it is not, then you are going to be on the lower end of the thyroid hormone production. If the liver is not working, which in most thyroid cases it is not, then you are going to be further on the lower end. So if we have a lower conversion on both of these, and this makes up at least 40%, if not more, of how much you are actually absorbing of thyroid hormone, then we have to address this. I hope that is making sense so far. So what would create a problem in the gut? Well, your bacteria, all the microbes, the microbiome, not just bacteria, all these different bugs, they actually are responsible for converting this T4 into T3. So what are some of the things that can create a problem? Well, any sort of imbalance in the gut can create a problem. So any sort of infection, because with an infection in the gut, now you're going to have an imbalance of bacteria. So you're not going to have the good bacteria to convert the T4 to T3. What else can create this? A sluggish or a slow moving liver. And what is that related to? Relates also back to the gut, because if the gut is not functioning and the liver's not functioning, these work hand in hand. So liver disease, not just liver disease, there's less liver disease, just less function of the liver, which again is also related to the gallbladder, the pancreas, and the stomach, along with the entire bowel system. So there's a number of pieces going on here, and when we work with people, it's very important that we're addressing all of these things. Now, lastly, we mentioned the immune system, which is the major portion of thyroid conditions. And when the immune system is not functioning properly, this is going to create problems. Now remember, 80% of the immune system is stored in the gut because these microbes create that immune barrier in the gut. So if the immune system is not functioning properly, then you are going to potentially start to attack the thyroid gland. When you start attacking the thyroid gland, you are not going to be, well, you may be potentially creating more T3 into the system, leaking that T3 into the body. When you leak the T3 further into the body, this can put you in a hyperthyroid state. But if you're not attacking the gland, if the immune system is relaxed, then this can create a downward production of thyroid hormone. So instead of your thyroid naturally being stable, it goes like this. So now you have hyperthyroid symptoms, and then you have hypothyroid symptoms. You have hyperthyroid symptoms, you have hypothyroid symptoms, hypo, and so on. And this is very characteristic of Hashimoto's disease. And this is also the reason why many patients with thyroid disease, number one, continue to have symptoms even though their doctor tells them that there's nothing wrong. They continue to change different doses of their medication very frequently, and the doctor keeps telling them, we'll try this one. And they continue to have severe frustration with this entire issue. Because as you can see, the medical model will look at this and they will say, your thyroid hormone is high, so let's calm it down, I'll give you medication for it. Your thyroid hormone is low, let's give you medication for it. And they are not addressing, number one, the nutrient deficiencies. So not addressing any of these nutrients. There's many more in addition. They're also not addressing the gut. They're not looking at that. They're not addressing the liver. They're not addressing any potential infections, not just in the gut, but elsewhere in the body as well. And they're also not addressing the immune system, which is one of the major players with all of this. So when we work with people who have thyroid disorders, this is why it's absolutely crucial to not just look at a full thyroid panel, which includes not just these markers, but many others. It is also to look at the gut and do a proper stool test. It is also to look at nutrient deficiencies and other organic acids that can be spilling out into the urine, indicating that the entire blueprint for the body, meaning you're not breaking down your carbohydrates properly, you're not breaking down your fats properly, you're not breaking down your protein properly. It's all going to affect production of this. You also need protein here. It's also important to look at the immune system. So we want to check for leaky gut, which is the number one thing that is the gateway to all autoimmune conditions, including Hashimoto's disease, along with many other conditions. Because if you're dealing with a thyroid issue, chances are you don't just have a little bit of sluggishness. You're losing your hair, your nails are dry and brittle. Maybe you're losing the outer third of your eyebrow. You probably are potentially losing your hair. You're very tired. You can't wake up in the morning. You get headaches. You have swelling in the ankles. You are fatigued. A lot of other symptoms, including possibly skin rashes, possibly you're getting a lot of colds and flus frequently. You know, you just don't have the energy that you used to, and you want to get back to your normal self. If this is the issue that you've been dealing with, you need to look at the entire body. It does not work in isolated compartments. So I hope this gave you some answers today on the thyroid hormone pathway. It's a quick rundown and all of the different body systems that it can affect. And there's many more. We just wanted to keep this as concise and short as possible so you get a good understanding of what needs to be done, what needs to be tested for, what needs to be looked at. So please, if your doctor is only running a couple markers for you and your thyroid, and you're not getting better, which chances are that is the case as we see hundreds of people with that, then speak with someone, whether it is myself or another functional medicine practitioner, who can take you down this pathway to health so that you can actually recover completely and not have to deal with these chronic thyroid symptoms anymore. Thank you for watching. I'm Dr. Anthony Crifase.